Hello, everyone. We are excited you're joining us today for our Quick Boost webinar, Quick Path to School-Wide Screening. I'm Dr. Jennifer Salerno, and I'm going to be sharing just a few minutes with you about RAPS, the tool that's being used in a lot of school-wide screenings across the country. And then my colleague, Sandy Rowe, is here, and she's going to be sharing some of her experiences in implementing school-wide screenings and kind of lessons learned and all the details you might be interested in knowing more about. If you're thinking about school-wide screening or just interested in learning more, this will be a really nice short webinar for all of those details. So just a little bit about RAPS. It is recognized and recommended by leading health organizations. You can see some of those logos listed here. It's being used across nearly 550 different types of settings: schools, school-based health centers, primary care practices, within programs, and in community-based organizations across 32 states. Some of the ways that RAPS can really help meet needs is by identifying those students or those youth that you're working with and who are those students in need. We know a lot of times some of those students, but then there's lots that are flying under the radar. And I know Sandy's had a lot of experience with that in identifying those students that really are in need and then being able to provide some of those resources, whether that's in schools or in the community, some of those referrals, some of those services that they might need from support staff or professionals in the community, providing referrals and follow-up, and then utilizing the RAP system to really understand your population, those students that are in need based on the questions, how many of them were referred, and how many of those access services. So you can dig into the analytics suite or the reporting suite as little or as much as you need to. And I'll share a little bit about what that looks like. So thinking about the RAPS was developed while I was at the University of Michigan, working with an amazing team of researchers, interdisciplinary clinicians, and youth to develop the questions and then the look and feel of the technology that is used to screen those students. The screening tool that we're focusing in on today is a version of RAPS that includes just the substance use, mental health questions, and protective factor questions. A lot of times when you're doing school-wide screening, this is a tool that is a little more acceptable or easy to implement. We also have the comprehensive RAPS that has 21 questions, and then a version of RAPS that we created with the American Public Health Association that includes some social determinants of health questions as well. And Sandy is going to share a little bit about the tools that she's used. The RAPS comprehensive tool is a validated tool as a comprehensive risk screening and also as a depression screening tool, as well as the 9-question version, the mental health substance use version that you can see some information here. Takes you just a couple minutes to complete that, and then you're able to review their responses. Typically, the screening is done on some type of device. It can be done on an iPad, on a computer, it can be done on a phone. So it really just depends on how you want to implement. Once that student completes the screening, the results automatically populate a report for you to view, and the analytics suite are all of your population-based reports. The user experience or the experience that the students have, we've really used a technology platform that's embedded in digital empathy. So digital empathy is really about the look and feel, how that technology provides the questions. They just see one at a time. There's images that help engage youth, make them feel more comfortable in responding to the questions. Therefore, you get more honest answers. Because if you're taking the time to implement a screening, whether that's individual or school-wide, you want to make sure that you're identifying those students that are in need in the highest level as possible for them to feel comfortable and be honest. The technology was really designed to engage them. They can complete the screening in English and Spanish. They can also click a button to listen to the text on each page. You can send a screening to their cell phone number, to their email address, or they can screen just by entering their student ID. And then when they complete the screening, they see health messages that are brief interventions that help them think through either getting help for a risk or reducing their risk. And I'll show you what some of that looks like. So this is the look and feel for youth when they complete the RAPS, using that digital empathy and some focus group feedback that we had. We incorporated some design elements to really engage them. This is an example of that brief intervention, or those messages that they receive when they complete the screening, that really gives them ideas in bullet points of either getting help or reducing their risk. Then there's a self-efficacy statement. And then we've included resources that are government or national organizations that are specifically for youth around each of the questions. And they'll see these brief interventions only for those questions they identified as a risk for themselves. Then you can see here what that summary looks like for you as a professional. If you're going to look at those completed surveys by student, you'll see tallies of risk. You'll see the questions that were identified as a risk populate underneath the tallies, and then you can click the information button to see that brief intervention or those health messages that that student saw as a jumping off point for your conversations. And then we have a full analytics suite. I'll show you just a few of those reports, population-based reports, and then you can dig into really identify those students that are at risk for each question. So this report really shows you those population risks, those questions that were identified most often as a risk at the top, down to the least with the percent of your population. If you click on the bar, you can see those actual students that answer that question as a risk. So if you're doing school-wide screening, this would give you a list of students by question that you might want to follow up with individually. And then there's another report that will show you that risk over time. So if you're screening students, providing some level of intervention or referral, and then you may be screening them over time, maybe every year or at the beginning and end of the year, this report will pull in those students that have completed more than one survey to let you know if their risks have improved over that time frame. So that was just a quick background so that you had an idea of what the RAP system looks like. And I'm going to turn it over to Sandy to share some of her experiences in using RAPS.
Thanks, Jennifer. This slide that you're seeing now is the cover of the report that we did. I'm in Pender County, North Carolina, and we didn't know what we didn't know, but I loved the RAPS screening so much that we decided to do it district-wide so that we could get a real snapshot of where our kids were. We did the comprehensive one. And we did it from 9 years old all the way through seniors in high school. We took 1 month to do each level. We did elementary 1 month, middle school the next month, and high school the next month, and staggered it on, we did one school a week and staggered it on Monday and Wednesday so we could respond to any of the red flags that needed attention within 24 hours on the day off. So we always did the assessments on Monday and Wednesday so that we would have Tuesday and Thursday free and we had all hands on deck to be present at the schools. We had guidance counselors from all the schools come over. We have an integrated system of care. So we have behavioral health people on our school-based health team. We just dove in. We followed Dr. Stephanie Daniels out of Winston-Salem, gave us a great template. So we followed hers, and we did an opt-out consent. We did 3 points of contact. The principals did an all call. We sent letters home to every student, and the district-wide website had opt-out options. Otherwise, we gave it to everyone that was in the school. I mean, the students, the older ones, could opt out if they wanted to as well. Excuse me. But that way we got almost 5,000 kids out of the 10,000 in the district that were that took the test for us, and we got data from all of them. You can go to the next one, Jen. We had heard, we sort of knew what was going on because we have such great partners in our school district. We work with all of the school nurses. We are very familiar with all the guidance counselors. We provide primary care, mental health care, and health education in our school-based health center. So we have a real good, our goal is to have that integrated health component so that we can help the kids wherever they are. If the primary care physician said, I don't see anything wrong physically, why don't you do a brief assessment with the mental health person? So we try to have the kids, we try to catch them at every possible place. Teachers, staff, coaches, they all know that PATH is right there available for them. And they had been telling us, you know, our kids are not doing well there. And but we didn't know the numbers. We didn't know how to help them if we didn't know who we were, because our district did one of the non-identifying risk assessments. So we knew the problem was out there, but we didn't know who they were. And if you don't know who they are, how can you help them? You can do the next one. One of the things that we ended up loving the most about RAPS, and you know, full disclosure, I'm a huge advocate. I love it. But one of the things that I'm not sure was that evident when Jennifer was explaining is how user-friendly it is. It was very easy to bring everybody that was going to be using the data on board. We were lucky in our school district that all of the students are issued Chromebooks. And so the IT department at RAPS and our IT department worked together seamlessly to get all of the kids a login, and we just used their student identifier that they logged into their Chromebooks on anyway. And so that was pretty seamless, and it seemed a little daunting when we first started out, when we first did it, but it's extremely user-friendly. And they were able to help us find what the greatest risks were, because we did the comprehensive one, which kids were in the greatest need, and then we knew how to help them. Actually, I think we stuck that. One of the things that the anecdote that I like to tell is that when we had the guidance counselors on board, after they take the RAPS survey, you have the data available to you immediately. You can see within 5 minutes of closing out the survey, which kids are flagging positively for the most, well, for whatever, but we wanted to make sure that we got the highest ones, suicidal ideation or some kind of abuse or self-harm first. And we were able to see those kids immediately, and we would, if there was a bunch of kids at each school, we would have the guidance counselors on deck. And this one guidance counselor said, well, I'll see that. When we got the list of the ones that we needed to contact immediately, the guidance counselor was like, well, I'll take that one. I've been working with her all year. And so she came in and talked with her, and then there was kind of a big problem there. And she talked to us later and said, I've been working with that young lady all year, and she answered positively for suicidal ideation, and she had a plan. And I just asked her, why didn't you ever say anything to me. And the young girl said, because you never asked me. So we have to ask them, and that's what RAPS does for us in a way that they feel comfortable answering. Okay. This is the numbers that we came up with of those almost 5,000 kids that we surveyed. The first columns are the older child and the standard RAPS. The reason that that orange one is orange shaded area in the middle is because we decided for our middle schools that we would do the standard from 7th grade on up. So the 6th graders at the middle schools took the same one as the 3rd grade through 5th grade. So we did 3rd through 6th. And so those are the orange ones are the middle schools there. And so you can see from this that we really didn't know what we didn't know. And it was really good that we staggered it, because we ended up having over 1,000 children that needed follow-up within 24 hours. The other good thing was that we have a really good mental health partner. So we were able to make certain that when we showed them these numbers, we brought on a lot more therapists. And now with COVID and all the things that the kids have gone through, we could hire as many therapists yet again and still wouldn't have room for them. But we've been able to use our RAPS data to say, well, these kids are, because you can put in the different things. You can say, okay, this one had the double red flag of suicidal ideation and abuse, but they also have smoking, alcohol, and you can query it any way you want to, so that you can see the ones that have even higher levels of need. And we can then use our resources of face-to-face therapists in the school setting for those children. And then the ones that, they may just have had a bad breakup or something and they were feeling depressed for a time, we can then do maybe teletherapy with them or group therapy with them. But you can really play with the data and use the data in a way that helps you laser focus on those kids that you want to try to get to. Well, you want to get to all of them, but the ones that are in the greatest needs at that moment, and the RAPS data helps you do that.
Great. I think those were your slides, Sandy. If you have anything else that you didn't share that you want to.
No, that's okay. You go ahead, and then if there are questions,
Yeah.
I'll be happy to answer them
Great.
later.
Great. Yep. So RAPS itself, we work more under a social mission. So the technology is much less than what you would expect. We do have a pricing model of an annual subscription fee by school building. And depending on the amount of surveys that you would be completing, we could provide you with some pricing related to that. There's also a one-time implementation fee that kind of sets up your school district or your organization within the database so that you have a secured environment. No one can see the information you're putting in unless you give them access through that login ID. Pretty much easy steps. It takes a couple weeks to implement, not that much longer of a time. Getting the license agreement together usually takes probably the longest. And then we have a very robust training support. We have videos that have been recorded. We have references as well as live virtual trainings. And like Sandy said, it's meant to be a very easy to use system. So if you're bringing in other people to kind of look at the data with you or look at the reports, there's an opportunity to give people access to just those de-identified reports, and it doesn't take a lot of training to figure out how to use all of that piece. So I'm going to open it up to questions. If you have any questions for myself or for Sandy, anything you feel like you want to know related to the implementation in school-wide, definitely takes some planning. I think Sandy mentioned she had some help from Dr. Daniels in just experience and letters and forms and things like that. We also have a complete kind of folder of materials that can help you if you're planning a school-wide screening. We'll wait a minute. If you want to use chat or the question and answer, we have both of those up. Definitely reach out if you have questions that you're thinking about that come up maybe after we close the webinar. We'll send a follow-up email as well with the recording so that you have an opportunity to go back, look at the information, send it out to others. If you have other people in your organization that are also interested in school-wide screening, we'll be sending you a follow-up email either tomorrow or early next week. So I don't see any questions, Sandy. Thank you everyone for your attendance. And oh, we do have a question here. Can anyone implement the screening or do they need to hold certain credentials? So related to the RAPS, anyone can implement the screening. We have community health workers that are in the community that don't have education behind the work that they're doing, and all the way up to physicians and physician offices that are providing that kind of follow-up, mental health providers. So anyone can implement the screening. The brief interventions are meant to provide some of that support to following up with the students or the youth. You definitely want to have those referrals or resources for professionals for those students that you're identifying as in need. Sandy, do you have anything else to add related to your kind of tiered follow-up?
Oh, I see the question. What is that question, Jennifer? That was the opt-out.
Did you have anything else to add related to who was providing the screening, like their credentials, or did you have any criteria related to your project?
No, we already, because we're a school-based health center, we already had teams that we could rely on. And, you know, that is an important thing, that if you're going to use RAPS, you know, once you find out that a child is, if one of them flags for one of the most severe ones, you have an obligation to help them. You have an obligation. Once you know about it, you have to have the resources to be able to follow up. That was one of the things that, because when we first started out, we were thinking, well, we'll just do the whole district. And Dr. Daniels was like, well, wait a minute, are you going to be able to see all of the kids? And we were like, oh no. So that's why we staggered it. So just make sure that you have if you're going to ask the question, you have to have resources to back it up if somebody answers yes, that they're in trouble in some way.
Yep. And I know other schools have also partnered with the community, different community agencies. Yeah. There's a question around the opt-out form, if it's separate from a standard medical consent form.
Yes, yes. And I'll be happy to share it. That opt-out form came from Dr. Daniels, and she's given me permission to share it as well. So I would be happy to share that, but it was specific just to RAPS. We sent the letters home that said we're going to be doing a risk assessment for the, you know, we were pretty vague on, you know, we didn't tell them what the questions were. Not vague, that's not the right thing, but we described that there were some, I can't remember exactly. It was very short and sweet, and it was, there are some questions on there that deal with sexuality. If you're not comfortable with this, or we respect X, Y, and Z, then you can opt your child out. And that's really all it said. It was very short, very sweet. We're gonna be implementing this district-wide. If you don't want your child to participate, please send this letter out. And so as not to call the child out, since the whole district was doing it, they signed into their Chromebook just like everyone else did. But when the RAPS thing came up, it would have an opt out. So the child just didn't, they didn't have to say, well, I'm not doing it. It was just kind of taken care of behind the scenes.
I think it's different than a standard medical consent form because it wasn't happening in the clinic. It was actually happening school-wide. So that's the additional piece of needing. Typically, schools will need an opt-in or an opt-out letter because it's not part of a clinical service that's being provided. It's more of a something that's happening on the school side that you're partnering with. Yep, and I think Grady put his email in to send a copy of the opt-out form, so we can do that. Yep. Or you could send that to me, Sandy, and then I could send it on.
Okay, yeah, I'd be happy to.
All right. Well, thank you again, everyone. And if any questions come up after, if you need resources, we definitely have lots of protocols and things. If you're doing school-wide screenings, looks a little bit different than screening in a school-based health center or within a program that you already have a consent form for that student. This is more of a general screening of all students. So can look very different and feel challenging at the beginning when you take it on. But we have some resources to help you smooth through the process. Yes.
It's very, very easy.
Oh, thank you so much. Thank you, Sandy, for coming on.
My pleasure.
Appreciate it. Have a wonderful afternoon, everyone.
Bye.